We ask a lot of questions, but I'll tell you what, it's interesting to ask somebody what brought them into nursing.
In so many words, how are you able to deal with conflict or, say, a challenging patient? And not just really how are you able to deal with it, but give me a scenario when you've had a challenging patient or family. What was the issue? How did you resolve it? And what was the outcome? Another question that I always ask is kind of like a critical thinking question. You give them a scenario of a patient condition and see how would they respond. And it's really looking at the critical thinking piece. Are they tying all the pieces together? I think another question that I always ask is kind of like about change. Healthcare is changing. So we have to be able to be fluid. We have to be able to bend. We have to be able to be flexible. And how do you deal with change?
New nurses should always be prepared to answer one, what are their career goals for the next 5 years? So what do you plan on doing with yourself for the next 5 years as you develop your skills as a novice nurse? And always thinking about the next step. Also, how do you escalate and when to escalate? So new grads also have to know that there is an escalation process regardless of where you work. So how do you go about escalating things when you are not able to manage them on a one-to-one level? And then I think what are they looking for from their employer is another big question that I like to ask. Not everyone is looking for the same thing, but those are some of the most common things you should think about when you're interviewing for a new job.
My top 3 favorite questions during an interview process would be 1, what your future goals are. Where do you see yourself going in nursing and throughout your career? The second would be around conflict resolution specific to challenging patient situations and how you handle those. And third would be around teamwork and what you define as teamwork, but also how you handle conflict in the team environment.
So my top 3 kind of categories of questions that I really look into and really want to know a lot about is how you do manage stress in the workplace and examples of that. I like to be prepared to discuss not only strategies that you mitigate and use during a stressful environment inside and outside the hospital because, burnout and building resiliency, we all own in the hospital. We also own outside of the hospital. And it's important to really kind of acknowledge those strategies and be able to kind of speak to them. And be prepared to put those strategies into place when you on board with us. The other questions I have, I'm really big on communication. The American Association of Critical Care Nursing has 6 key principles of a healthy work environment, and skilled communication is really key. The way that we communicate and collaborate with each other really sets up for a healthy work environment and one that promotes learning, high quality and safe patient care. So I really speak a lot about, tell me about a time when you had to give difficult or challenging feedback to a colleague or a coworker. And at the same time, tell me about a time when you had to receive really difficult feedback and how you managed that. Because it's just a lifelong journey in nursing and healthcare, and we have to be able to communicate and learn from one another throughout our journey. And lastly, I would say customer service. Tell me about a time when you went above and beyond for a patient, a family, or even a client if you haven't been in the healthcare environment. But customer service is so key to what we do.
Thanks for watching. To get full access to our Simple Nursing New Grad Prep course filled with tons of helpful tips and tricks, simply click the link in our description below. Remember, don't be scared, be prepared. Ensure a smooth transition into your nursing career with our new course. See you guys there.